Tonight, 6 easy ways to hospital-proof your lactation situation should you be giving birth in a hospital. It'll help, I promise. If this is your first time here with us, don't forget to like, subscribe, hit the notification bell, find me on my website, head over to Instagram and chat with me there. Let's get on with the show. Okay, so let me start off by giving some credentials. The majority of my work experience as a lactation consultant has actually been in the hospital setting. It's where I started, it's where I got my training, it's where I've worked for the last almost 9 years. God, I'm getting old. I'm hoping to be able to use my sometimes not so fabulous experience working in that environment to sort of prepare you and give you the tools to make sure that, just like the byproducts of day-to-day life in a hospital don't get in the way of you being successful in breastfeeding your baby, because good Lord, they have the ability to. You also might be wondering why in the world anybody would need to hospital-proof a lactation situation. And it's unfortunate, but the reality of it is when you give birth in a hospital, and a lot of us don't have a choice about it, but if that's where we're going to be, you kind of have this revolving door of providers. You never really know which doctor is going to be on call. You never really know which nurse you're going to get. And it doesn't really matter because 12 hours later, you're going to have someone completely new coming in to give you support. So there's really not a lot of continuity of care. Everybody isn't normally speaking to one another, giving each other great details. There's not a whole lot of collaboration happening. So it's really easy for someone to come in and look at a situation and say, based on my experience and my clinical assessment, that looks great. And then 12 hours later, whoever's coming in looks at the situation and has a completely different reaction. So without further ado, here is tip number 1. Please, before you give birth, get in touch with the hospital where you plan on birthing and ask to speak to their lactation consultants. We love chatting with people prenatally. In fact, I could contend that the fact that everyone isn't receiving prenatal lactation assessments and support is criminal. That's for a different day. But you do want to give us a call and just be like, hey, what's your name? How many folks do you have on staff? What can I expect if I give birth at 3 in the morning versus 3 in the afternoon? Get your feet wet, get to know us. If you call your hospital or the hospital you plan on delivering at and they don't have any lactation consultants, might I recommend finding a hospital who's got their priorities straight? Sorry. Tip number 2, when you get admitted, most hospital staff will ask you what your plans are for feeding your baby. In my experience, a lot of mothers will say that they plan on doing breast and bottle, really more than anything out of a fear that A, breast won't work, and B, they won't give you the bottle because you already said you just wanted to do the breast. Nobody is going to deny you some formula. If you need it, we got it. If you change your mind, we have it. If things change and suddenly we don't have a choice about it, it's everywhere. There is no shortage of artificial infant milk. So if you tell them that you plan on breastfeeding, because you do, even if you plan on doing the other stuff, we've really got a very sweet spot of time where we can get that up and running, and in the hospital is the most critical. So we will, not to say that we don't focus on everybody, right? Focus on everybody. But for those who come in and say, I want to breastfeed, and aren't afraid to say that that's the plan and are committed to that, they will be a lot more on it in terms of getting you care and getting you the lactation consultants and working with you if they know that it's important to you. I don't think there's anything wrong with wanting to do both. I do think there's something wrong with doing both in the beginning because it will make it impossible to do both because you won't be able to breastfeed. So let's get started with the boobs, and if you're planning on breastfeeding as well, then just tell them that when you get there. We can change the plan later. Number 3, and this admittedly is not the easiest to do, a lot easier to say. I personally have given birth 3 times, once in a hospital and twice at home. And if I'm being honest, you probably couldn't pay me to give birth at a hospital again, unless I was dying or something. Sidebar. What you're going to want to keep in mind is that every intervention that is offered to you or that is employed during a labor can and will affect your ability to get milk moving, your ability for your body to understand that milk needs to be moving, and your baby's ability to actually do the work to get the milk moving. So while I would never deny a woman who really truly wanted and needed an epidural, might I advise waiting as long as you can to get that epidural. If you're in labor at home as long as you can. The minute you step foot in the hospital, the clock starts. And you are now on a timer, and you got to get things done at a certain amount of time, or else, I don't know, I guess the world implodes? I'm not entirely sure. So the biggest way in which this timer works against the laboring person is that the closer you get to the end of that specific time, the more likely your doctors are to maybe not so much recommend, but strongly encourage that you go ahead and consent to things like Pitocin or epidurals or more increased, more frequent vaginal checks. All things that may be necessary sometimes, but are overused most of the time and can lead to your baby and your body just not working so great, or even your baby ending up in NICU, and then breastfeeding is really challenging. So when it comes time for you to labor this person down, stay home as long as you can, avoid the interventions as long as you can, and remember, you are the boss of your body, and you still get to give consent or not give consent for anything. Yeah? Onward and upward. Okay, so number 4, your beautiful baby or babies are out. However, they came out. You're an unbelievable badass and should be tremendously proud of yourself. And now you really kind of have to fight to keep your babies skin to skin with you. It is the policy of most hospitals to facilitate the golden hour, that 1 to 2 hours of skin-to-skin contact that you're supposed to be with your baby, breathing in all their amazing fumes and scents, and breathing and letting your hormones do what hormones are meant to do to create that bond and help get your uterus contracting because the baby's feeding and things are moving and easing up. However, again, since you're not really sure who's going to be there at delivery time, you don't know which nurse you're going to have, you don't know which doctor you're going to have, it's really easy for this to kind of just fall to the wayside. And it is your responsibility now as the parent to not just do what they do. If the nurse swaddles your baby like a burrito and hands the baby to dad or grandma or the doula or whomever you're allowed to have with you in the days of COVID, you don't have to be okay with that. You can say, no, unwrap my baby, put him on me. I thought we were doing skin to skin. It's really important for us to not interrupt this part of the process if we can avoid it at this time. The hormones are doing special stuff, and getting your milk out in the first hour can mean that maybe you've transitioned to mature milk by day 2, not 3 to 5 like all those ridiculous books say. That's a problem. If your milk has not transitioned before day 3 to 5, like, that's not normal. Call me. Just call me. It's not normal. So when your baby has had, because you fought for it and your birthing partner has assisted in making this happen, and you've had that hour or two and breastfeeding has started and things are moving and you get to your room in the postpartum ward, you don't have to stop the skin to skin. And in fact, it's better for your baby if you don't. It's not possible to spoil a baby, as we've discussed before and we'll discuss again ad nauseum until everybody understands it. But you really need to keep them at the table. So the more skin to skin you do, the better breastfeeding is going to go. They can't practice feeding if they're in a box on the other side of the room. So long as it's safe for you to have your baby with you, say you have a supervisor in grandma or auntie or dad or whomever at bedside, girl, just keep that kid on you. Don't fight it. Number 5, if you don't feel like breastfeeding has necessarily gotten off to the best start, if you have a super vomity baby who's got fluids coming out of his ears and he doesn't really want to latch on because the gag reflex is crazy, you can ask to hold off on certain procedures. You don't need to have a bath in the first 12 hours. You don't need to have a bath in the first day. You don't need to have a bath in the first month. In fact, my middle child can attest to that because I don't think she got a bath, till she was like 2 months old. And she was my best smelling child. So you can imagine how that conversation went most of the time, right? None of these things have to happen right away. You can hold off on just about all of it. If there are things, for example, like the newborn screen or the PKU, that kind of stuff that needs to get done at a certain time, then have them do it on you. Sorry, not sorry. It can be done. I know it can be done because my midwife did it. So make them work for it. Because realistically, if you haven't gotten this going and your baby experiences some kind of stressful situation, and trust me, being away from you, even just long enough for you to go pee, is a stressful situation for your new baby, they're much more likely to do what babies do in order to protect themselves. Shut down. Wait for the danger to pass. Thing is, they can't really get up and go have a cigarette or talk about it with their bestie or take a yoga class. Babies don't really have a whole lot of ways to resolve excess stress or overstimulation or understimulation. And the way babies respond to those situations, truly, is to play possum and just pretend they're not there. That doesn't help breastfeeding because babies have to do all the work. All the work. All the work. And finally, the big one. Rude. What goes in must come out. Pretty basic, right? So if you happen to have a nurse on night shift who's maybe 5 years past her expiration date, she just wants your kid to go to bed and shush so that it's not so much work at 3 in the morning. It's a thing. 3 in the morning is a time in the hospital. She might recommend some formula because your baby's crying, starving. If you've been keeping track of the diapers, then it's a really easy thing for you to be like, nah, no, things are fine. If your baby is meeting their minimums for time at breast and poops and pees every 24 hours, then it's not a feeding issue. Keeping in mind, of course, that you know that baby has been having a disco dance party every night since you've been able to feel them having that disco dance party, and it's not likely that they're suddenly going to come out and understand that when they used to have the disco dance party, they're supposed to be asleep. We expect babies to be in this reverse cycle for a minute. When they'll get out of it depends on the baby, the feeding method, the way sleeping is going, daylight savings time, all of these horrible things that come in and mess with sleep and whatever. It's normal for babies to be up all night. They're going to sleep like bricks during the day, and then the sun is going to go down and it's going to be party time. You can let your nurse know I told you so. Insider secret. So, if you are giving birth in a hospital, nothing to be afraid of. Just recommend doing a little research and making sure that whoever is going to be with you knows how to adequately support you. Not like my husband did in the hospital. He slept. He slept for the entire time we were in the hospital. Poor baby was tired. He slept until it was time to push, and then as I lay on my back, spread eagle, and 20 people who I had never seen and never saw again, just staring at my very angry vagina, he woke up and cheered me on for that part of it. Marriage is exhausting. If you need to give birth in a hospital, it's gonna be okay. Do your research, make sure your partner's on board with what needs to happen, and just know that you can at any point be like, where's the lactation consultant? There are places you can reach out for help. There are a million people out there who want to give you the support. If you can't find them, let me know and I will either help you myself or find some for you. And if you wouldn't mind, please let us know, especially if you've had the experience of breastfeeding in the hospital setting more than once, what your experiences were like. I think it's good for us to tell our stories and, commiserate and stuff. So that's it for tonight, y'all. Happy booping.